All right, so I think we actually have Sahpra on the line. So let's go straight to that. Of course, the South African Health Products Regulatory Authority making a very important announcement today that the application made by Pfizer mid-November for a third booster shot to be approved in South Africa has in fact now been approved. What this means really is that 6 months after you had your second Pfizer dose, you will qualify for a booster shot. So let's speak now to Sahpra CEO Boitumelo Semete-Makokotlela. Thank you so much, Doctor, for joining us. So I'm wondering whether we know that Sahpra received the application from Pfizer in mid-November before anyone had heard of Omicron. But I'm wondering if when you heard about the new variant, it didn't sort of lend a sense of urgency to approving this booster.
No, thank you. And again, thanks for having us this evening. So it did indeed. I mean, we were in the country having a conversation around the boosters anyway, because of what we were seeing, globally, and had been engaging with both Pfizer as well as J&J. And so, the current conversations are really to look at the neutralizing data for these vaccines. And we're starting to see some data come through that demonstrates that these vaccines may still sustain a level of immunity even against the Omicron variant.
It's interesting what Pfizer is saying, and they're saying it's still effective in preventing COVID-19 if it's administered 3 times. So I suppose my next question is, should we be waiting 6 months after our second dose, or should we, particularly in more vulnerable members of the population, be doing that third dose a lot sooner than 6 months after your last?
Yeah. So, I mean, the important thing, particularly for us as a regulator, is that whatever decision we make, we need to ensure that there's scientific data that backs up that decision. So you will note that what we've authorized today are 2 elements of this. The first is that for those who are 18 years and above, the data that Pfizer has provided, which we are very happy with, is that it can be made available after 6 months. They've also looked at those who are severely immune compromised, and then have said those can receive, based on the data they have, they can receive the vaccine earlier. So whatever decision we make, irrespective of what we're seeing, in the media being published, etc., it has to be, properly designed from a scientific perspective.
Yes, absolutely. If the fact that Pfizer has applied for this booster and received approval, and now there's information that it's saying actually a third dose really is going to make a difference with Omicron, can they simply add that in, or would they have to go through an approval process again to suggest that the booster perhaps should happen a little earlier than 6 months after your last one?
Yeah. So, I mean, with all the vaccines that we've authorized, there's been a condition that with any emerging, whether it's the variants of concern or various variants of interest, they have to continuously assess the vaccine efficacy against those variants of concern. And so we are expecting that in a number of weeks or so, the manufacturers together with the scientists will start to provide us with data. And once we have that data, they can then say, particularly around this variant, what are they then proposing? But the initial data that we've seen now, just from the scientific community and some of the early publications, demonstrates that there may be still, some good level of immunity, but it's early data. It's being done by, some of the scientists across the world. So there's still a lot to be done to assess this, but the early data is looking very promising.
What about Johnson & Johnson? We know that people on the eNCA study qualified, those are the healthcare workers, for a booster or a second shot. What about ordinary members of the public who've received J&J? When will they get a booster? And has Johnson & Johnson received approval already for that through eNCA?
Yeah, so there's 2 elements that then are considerations here. Firstly, the eNCA 3D study, wherein we've approved that those that received the Johnson & Johnson vaccine can receive Johnson & Johnson, so it's still a homologous boost for J&J, while we are also then engaging with J&J and really trying to get them to submit an application to Sahpra so that it can be made available, broadly to the public. It is important that all of these decisions, go through quite a stringent regulatory process so that, we make sure that we take note of all the, considerations, and even from a safety perspective, that we've considered all the data that they would have made available. So as we speak, the Johnson & Johnson booster is available under Sisonke for the healthcare workers, and we are expecting a submission from J&J soon, which we will expedite the review thereof.
All right. And talk to us as well about the approval you gave for the South African-made rapid antigen test. Tell us a little bit more about it. I understand it is going to be cheaper. It's going to be made in Cape Town, which is great news. Can it be self-administered, and how rapid is rapid?
Yeah. So we are having a conversation with the Department of Health, the NICD, etc., because, we've had a number of requests around self-testing. So the national position has really been that the rapid tests, need to be administered, again, under the guidance of a healthcare professional. But we are seeing, stronger data around the reliance of these, reliability of these rapid tests from a sensitivity and a specificity element. And so we are having a discussion around self-testing because, again, those who've traveled into other countries, you've seen that that's taking place. A key element with self-testing is that we would need to ensure that, when one receives the report, the results, they are quite clear on what the results are saying. But secondly, that those results can be reported into the broader national reporting system. So those are some of the elements that we're discussing with the NICD, the NHLS, as well as the Department of Health.
And how rapid is rapid? I mean, is this the sort of thing that you could get a result within 10, 15 minutes? Is that the turnaround time, yes, obviously administered by a healthcare person?
Yeah, so this would take minutes, obviously, which then is better than a PCR test. So this will take minutes. So the sample would be collected and you will wait 15, 20 minutes and then you get your result.
And it's still one of those up the nose, isn't it?
We can't get away from that.
Drat. Anyway, it's good news, certainly. Thank you so much. That was Dr. Boitumelo Semete-Makokotlela. She's the CEO of the South African Health Products Regulatory Authority.